Hi, everybody. Welcome. We are here today to spend a little time with some people that are going to be at our fantastic event that's coming up in just a couple weeks, April 12, 13, and 14. I'm Leslyn. I'm with the Lipedema Project and Lipedema Simplified. And it's very early morning here in Southern California, but late in the evening in Western Australia. I'm here with Carrie Reedy. She is a fantastic person and keto coach that works with Lipedema Simplified and going to be a speaker at our wonderful event that's coming up in April, as I was saying. And so I'm just going to be here talking to Carrie about what she does, which is absolutely amazing, and what she's going to be speaking about at our event. So Carrie, welcome.
Oh, thank you for having me. It's great to have an opportunity. Well, firstly, to catch up with you, because I always love talking lipedema with you. But, just to share a little bit about the event and what I'm going to be speaking about, because it's going to be a full 3 days of amazing speakers. And I think anyone that comes, their minds will just be blown, because there is just there's so much research going on. There's so much more understanding. Every year, it seems like there's more and more understanding about ways that we can manage lipedema. And my piece in this, as a nutritionist, of course, I'm very excited about the dietary interventions. But actually, I'm not talking so much about dietary interventions this time, because
a different aspect of dietary interventions, because this heart-to-heart event, it's called Keto and Beyond, customizing your plan to joyful nutrition. And the beyond part is all the other parts of tweaking and changing and doing something with your diet. It's not just about the physical foods you eat, but how you're interacting with the rest of the people in your world, how you make that work. And so before we get into that, Carrie, can you tell a little bit about your background and education? Because you bring an incredible amount of knowledge to your work. And I just love you to talk a little bit about that background and training.
Sure. So my degree is in what we call here in Australia nutritional medicine, which is really just a way of looking at the way that we support our health with food. And of course, looking at, are there aspects of our biochemistry that aren't working optimally because we're missing nutrients? And so how do we use food to fix that? How, what's going on with the microbiome, what's happening with inflammation, a lot to do with the biochemistry of the body. But I guess my take on that is, certainly now that I've come to understand more about lipedema, is I bring that sort of knowledge and awareness of the big biochemistry picture and say, how do we apply this to what we now understand in terms of inflammation lowering ways of eating and strategies around that. And so, like you said, I'm a certified keto coach. I love working with people in trying out different ways of eating. And I'm a really big, I guess, advocate of saying there is no one size fits all. Whilst we know that keto can have incredible benefits for so many in our community, that doesn't mean it's going to work for everybody. And, really the only way we're going to know how it feels for us is to give it a go. So I'm very much a proponent of saying, test it out, see how your body responds. It's not an overnight fix, that's for sure. It takes time to sort of get the nuances of this way of eating right. But for some people, maybe in the earlier stages of lipedema, they may not even need to go quite to that extreme. And there may be people that have got more significant progression of their lipedema that may even need to be more aggressive in their dietary intervention, in the early stages, to take some pressure off their joints, to make, a quick difference. And then, of course, it's all about personalizing and individualizing the way of eating. And one of the things that I sort of feel like I repeat is the way that we end up eating for this is it needs to be sustainable. And so at this particular Heart to Heart, I'm going to be talking about some of the challenges of not just keto, but of trying to apply any type of therapeutic eating regime in the modern world that we live in, because it's challenging. It's challenging to swim against the tide of current thinking in terms of the Western food plate or food pyramid. you might go to the doctor and say, oh, I'm trying out this new diet. And they might say, oh, that's terrible, don't do it. And it's a hard place for an individual to be when they're trying to make a difference to this condition, and yet they're be giving all of these mixed messages. So, I'm a really big proponent of being, empowered to follow this journey yourself, to be true to yourself. And I'm really excited about talking about some of these aspects that maybe we haven't spoken about so much, about how do we navigate the challenges there. And I'm sure anyone that's listening will know that making any sort of dietary change isn't easy, because we're I guess creatures of habit, aren't we? We just kind of do the same thing. And so hopefully I can share some
the challenges are for a lot of people are not so well. It could be with their own initial habits and their cravings and the go-to foods. But it seems like a lot of people have that other aspect of when they're interacting with other people, when they're at social occasions, and maybe they don't want to stand out. I enjoy saying, I'm ready for some steak, bring it on. But other people may, when they're in a group of people who maybe prefer a plant-based diet, and maybe that's their loved ones, their family, and they don't want to, they're afraid of hurting feelings. How do you navigate all those interactions to still be comfortable with what you're eating, and being good to your own body, but also being kind to all those that you're with? And so that's a delicate balance, and you really excel at helping people navigate through those things.
Well, I think it's first of all acknowledging that it's a fine line, isn't it? That, we have to be true to ourselves, that we have to understand what we're trying to accomplish, why we're trying to accomplish it, and what the end goal of that is. And at the same time, be compassionate about other people around us. One of the things we I guess we joke about is that people can very easily get caught up in a diet religion. And I guess that's probably not the right terminology, but, whichever way you eat, you think, gee, this is working for me, it needs to work for everyone. Right. And I think we have to be careful about how we kind of have conversations around this, that we don't make it out that we know everything and everyone else is wrong. This is a very personal journey, and, it depends where our heritage is from. Somebody that's, say, from Northern European heritage can potentially navigate a different way of eating to someone that's, from South America or somewhere else. And we have to acknowledge that genetics plays a role, our ancestry plays a role, our food likes and dislikes. It's all well and good to say, hey, we need more protein, but I certainly come across people that are like, meat just doesn't sit well in my stomach. So then we have to navigate other ways around getting their protein, supporting their digestion, these sorts of things. And so it's about acknowledging where each person's at and thinking, what's the next step? What's the next thing to try? How do we do that? How do we do it around our community, around a family? And, I'm in a circumstance where, I've got 6 kids. Not all of them live at home now, but everyone eats in a slightly different way. How do you even put a meal on the table? Sometimes it's as simple as, how do I make something that everybody's going to eat? And so there are lots of challenges, and hopefully that as we sort of unravel some of that there'll be some takeaways for everyone. And, one of the things that I'm going to be speaking about is finding our North Star. Southern Cross here in Australia, we don't have a North Star, but when you have a North Star and you have that, it's set that this is what I'm trying to accomplish, then it does help us to navigate some of these more complicated aspects of what do you do when you're invited to a party and everyone's got all of this cake in front of you, and you don't want to be the person that says, oh, I don't eat that, because then somebody else is going to comment on it. And so there are some nuances to that, and I'm always talking to people about, I guess I would say it's almost, we need to know our nature. Some people could put a piece of cake on their plate and not have a mouthful. Some people put a piece of cake on their plate and go, well, I'm just going to eat it. It's about knowing ourselves. And so some of these strategies be very personalized, aren't they? You said before, you love nothing more than a great piece of steak. but everyone, we're all so unique, aren't we? About our likes and dislikes and how we.
And I think that the other thing that you help people discover is that the spectrum of foods available that are considered ketogenic to low carb is there is quite a bit a larger spectrum than people have thought before. I mean, they do think that, oh, if I'm going to eat ketogenically, I'm going to have to eat red meat. I'm going to have to eat high fat. Not necessarily the case, not necessarily what you need. We're finding that a lot of women with lipedema actually don't have to eat high fat. They have to get the carbohydrates down to a level that seems to work for them, but they don't necessarily have to eat a lot of fat. And there's a lot of variety of different foods that can supply the proteins that they need. And so discovering what those are, and still, like, for instance, you're from Latin America and your culture eats a certain style of foods. How do we eat that certain style, feel like I'm still eating my cultural foods, but still being the carbohydrates low? And these are the kinds of minefields that you help people navigate when you work with them individually. We're in a group and we're all generally doing this kind of a low carb style of eating, but a lot of people need that individual help that you give so they can figure out how to personalize it just for them.
And personalize it so that it's long-term sustainable, because we're not talking about making a short-term intervention for lipedema. We're not talking about going on a diet. We're talking about changing the way that we do things, because what we've done up to this point has potentially, and I don't say this in terms of blaming ourselves, but we've been following the general food guidelines and they haven't served us. Those of us with lipedema, they have not served us. And so it's about finding another way of doing things, but it's got to be that other way of doing things that works ongoing. And so if you're constantly fighting against some of these challenges about, this isn't the foods I like to eat, or this, they don't feel good when I eat them, you're not going to be able to keep doing it. So it's about experimenting. And, I always talk to people when I first meet them, like, do you like being in the kitchen? Do you like cooking? I think it helps. I think it helps when you actually find that fun. I think it's a bit more challenging when you are used to maybe eating out a lot, because it is much more tricky to get food that we would say is serving us when we're eating out a lot. Many of the ingredients in restaurant food, shop prepared food, isn't necessarily going to be the ingredients we would be choosing to use at home in terms of those inflammatory seed oils, that sort of thing. So again, it helps whether if you like cooking at home or you have somebody else at home that likes cooking, to be able to provide the most nourishing food to each person. But again, this is all very individual, isn't it?
Yeah, and I noticed a comment from Rebecca. She commented that, wow, it's really hard when you live with someone, or maybe a lot of someone's, who they eat differently than you do. They don't have any problem with eating things that are probably off your food plan. And so now those things that are probably pretty enticing are sitting in your cupboard. And so trying to resist that temptation. Again, another thing that you would assist people of coming up with strategies to deal with that circumstance is probably pretty common.
Oh, absolutely. Unless everybody in the household's, potentially eating in a low carb way, then the house is going to have all sorts of options around. And that's certainly the case at my house. I mean, we've tried some strategies along the lines of, my adult kids having different cupboards to keep their food in, or they're keeping things in it, in a drawer somewhere. I feel a little bit like out of sight, out of mind. It's when you see it. And I think Rebecca would agree. When you open the cupboard and it's like crisps or chocolate or other things, that it's hard.
Yes.
But if you're not feeling hungry, it is, and you're feeling satisfied with the foods you're eating, it does make it easier. The other suggestion around that is to have your own swaps. I mean, I still love chocolate. I still do. I said to someone just today, I think I came out of the womb loving chocolate because my mom loves chocolate and I'm sure that she ate a lot of it. But I would go for 1 square of very dark chocolate, maybe even, 85% chocolate rather than a whole block of something else. And so again, it fits within, I know what else I'm eating during the day. I know that I can navigate that, and it's fine. If I really am feeling tempted, then I would rather have something there that I can have rather than just try and white knuckle it through, because
you have some go-to foods. Have some go-to foods that are ready, so that whenever you're and everybody knows their own triggers. I had the stressful day at work. I know it's going to trigger me. I need to have this go-to thing. I have a day without anything planned and I'm kind of bored. I have something go-to. And so, coming up with those strategies, and sometimes you can work with someone to help them with a non-food idea. Because if your thing is that you're not hungry, you don't need nourishment, you're bored, then figuring out those other activities that you do to satisfy your boredom without, fixing that with food. I mean, and that's a common thing that we tend to address a lot of our needs with food, and it's not nourishment, it's addressing some other need, right?
I think there's probably a list of 10 different reasons that we eat, and nourishment's only one of them.
Right.
Boredom's certainly up there, but it's a comfort thing, it's the stress reliever. There's so many different things. And so again, if we just say no, you can't have it, or say to ourselves, no, we can't have it, without having another strategy in place to manage the stress or manage the the sadness or other things, then we're not setting ourselves up for success. And what we want to do is set ourselves up for success with any sort of intervention that we're trying, because it's hard work, so we want to get a positive result, don't we?
But another fun thing about that people may not realize when they embark on a ketogenic diet or some kind of carbohydrate restriction, they may think of it all as restriction and denial. But it's kind of fun for when you show them that there's a lot of foods that they have been denying themselves from eating previously because I thought they were bad for them. And then they find out this is actually good for me. And so there can be a little bit of excitement and celebration because you find out that these foods that you thought you couldn't have are now available to you. And so you might find that you actually like this way of eating.
Oh my goodness, give me a cheese board any day. I get very excited about all sorts of interesting foods that maybe, like you say, in the past we've thought, oh, that's potentially got fat in it, I shouldn't eat it. Whereas now we're understanding that actually our bodies need these fats. They are very helpful to us. It's just about, having balance, and certainly lowering those carbohydrates seems to be helpful for everyone with lipedema, whether, whatever other sorts of ways that they're eating, just, dramatically reducing those carbs just seems so beneficial. But like I said, that means that we're swimming against the tide. We're going to have people socially make comments about, oh, that's an unhealthy way of eating, or, oh, I read this comment online that, it's going to kill you.
Right.
And sometimes it's hard to defend ourselves. And we don't think we should have to be in there defending ourselves. I think people are entitled to their opinion. But if we're aware and educated enough about what we're trying to accomplish, then, and we have some go-to responses for comments like that, then we can navigate them far easier.
Right. And I think that is one of the most challenging things, that you feel like you're going out on a limb trying something that's going to help you, and it seems to be helping you, and you're feeling better. Yet you're like you say, you're feeling like you have to constantly defend yourself, and you shouldn't have to be placed in that position. But that commonly is. When you're the odd person out and you're going against the tide, then you commonly are in that position. But hopefully that is balanced out by all the benefits that you're realizing. And many people do realize benefits from eating this way. I think we have like 15,000 anecdotes in our Facebook group that these N=1 personal treatment experimentation that people are doing in our keto lifestyle for lipedema Facebook group. they're talking about, what has happened for them. And it is pretty spectacular. I'm so glad that you're out there guiding people on this journey that can be challenging, but very satisfying and so very helpful.
Absolutely. And, one of the things that I would say about that is ultimately, we're doing this for us. And so
Yes.
we've got to be mindful that other people are going to have their opinions.
Yes.
But it's us that is trying to navigate each day with the symptoms of lipedema. And if that means that we've got to try and eat in a different way, that, can be challenging. It can be hard meeting friends at a restaurant. What do you pick? There's not a lot of easy choices. But if that means by doing that you have a reduction in your pain, that you have a reduction in the swelling, that you feel more comfortable in your own skin, hey, that to me is a small sacrifice for a really big win.
Yes, absolutely. And once again, Carrie is going to be part of our Heart to Heart event that's happening this April 12, 13, and 14. It's all online. And so it's a 3-day virtual conference, Keto and Beyond, customizing your plan to joyful nutrition. She's going to be one of many wonderful speakers, patient panelists, and opportunities for you to collaborate and have a discussion with everybody else that's attending the event, clinicians, patients, vendors who have products that can support us in this activity. So be there to join the conversation with us. There's a link below so you can find out more information and to register. Please join us. We'd love to see you there. Carrie, thank you so much for talking to me today and telling people about what you do and what a benefit this way of eating can be for people. Thank you so much for being here.
Oh, thank you for having me, and I'm looking forward to being part of the event.
Thanks, Carrie. Okay, see everybody next time.